Welcome, everybody. Greetings. Thanks you for being here today. We are broadcasting live from Park City, Utah, Atlanta, Georgia, Tampa Bay, Florida, and where's he, Andrew?
Drew is also Tampa Bay area.
Tampa Bay area. So again, as usual, thank you all for participating with Family Office Insights as you have in the past and continue to do. We're super grateful for you participating. We have a super interesting presentation today. All of our presentations are interesting. In this case, I've actually experienced a scan. Is that what you call it? A scan? What's the proper term?
Yeah, a screen or an assessment.
Assessment, which is done remotely, which is super fascinating. And I will admit that it must be accurate because I had no problems. So all the yoga is paying off. I've experienced this. It's fascinating technology, and you'll see why it's scalable in the presentation. As usual, we'll make sure that you're in touch directly with the presenters, Walter and Peter and company, and also Robert, who couldn't make it today. And as you see the presentation, if there's anybody that you think would benefit in knowing more, you'll be able to share the recording on the Family Office Insights YouTube channel, and also feel free to connect directly with the Peter or Walter, whoever you care to connect with to learn more about the opportunity. So just to be super clear, we're talking today about an ongoing raise. And so just have that in your mind while you're watching the presentation. And again, thank you all for your robust participation in our webinar and Luminary series. We super appreciate it here at Family Office Insights and grateful for you. So with that, Walter, you want to take it away?
Sure. Thank you, Arthur. And thank you, everyone, for your participation today and learning a little bit more about MyMedicalHUB. Before we begin the formal part of the presentation, which Peter is going to walk you through, what I'd like to do is give you a brief background of the underpinnings of MyMedicalHUB. First, we focus in the area of musculoskeletal health. We are a machine learning company. The underpinnings of what we do stem from a 4.5-year-long study where folks from Johns Hopkins, Mayo, Stanford, Georgetown School of Medicine, and New York Chiropractic College had gotten together, and along with biostatisticians, and they looked for a way of biometrically evaluating one's musculoskeletal health, right? So when you take a look at healthcare and how we look at preventing certain diseases, there's lots of ways biometrically to identify risk factors. So today we're all familiar with things like glucometers to look at one's risk of diabetes, blood pressure, cholesterol levels. But for musculoskeletal, there really hasn't been a way until now to identify who is at risk and who is at risk within the different regions of your body. So these different clinicians of different musculoskeletal professions had gotten together with these biostatisticians, and they developed a method of assessing somebody where they were able to collect enough risk factors to identify in a quantifiable way, in a predictive way, to what extent somebody either is trending towards or has an injury. And today we have the ability to predict to over a 96% specificity of accuracy whether or not somebody is predisposed to an injury. MyMedicalHUB machine learned that entire study, that entire process. And we also evolved our technology to not only identify who is at risk, but what are the potential or likely diagnoses or care classifications one is trending towards, right? So today we have the ability to assess large populations. This is something that could be done virtually. It is something that could be done with or without a human. We have developed our own musculoskeletal assistant. Today, I'm sure all of you are familiar with Siri or Google Assistant or Amazon Alexa. We have developed our own musculoskeletal health assistant that can walk somebody through this entire evaluation and also identify those risks. We can create a narrative, much like a physician or a clinician would, and will also pull the evidence-based research to support the findings of those risks. And you're going to get to see that today in how we do this. This is something that can also be done through a telemedicine platform, which you're going to get to see, where Drew Verna will be assessing me today. So you can get to take a look at how this system and how this machine learning can perform these evaluations and find these risks really ubiquitously pretty much anywhere in the world today. Musculoskeletal disorders is a major problem, not just here in the United States, but it's a global issue. However, here in the United States, we spend $1 trillion or approximately $1 trillion in musculoskeletal injuries. I know most of you are aware of the opioid epidemic here in the United States. We spend over $86 billion a year of opioids. You know, the answer for people who have been in pain historically in the past has been administering, as part of these plans of care, those opioids. But we believe by identifying who's at risk before people are in pain is paramount. So we have the only solution that we're aware of that can quantify both the subjective and objective findings and have the ability to predict to what extent somebody has an injury or is trending towards an injury. And we can also, because the system can identify those underlying risk factors, which identifies the causation of those injuries, we also have the ability to help to develop a plan of care that's meant to mitigate those risk factors. So you're going to get to see some of that here today. With that being said, I'd like to pass this over to Peter Acabel, where Peter will show you a brief video on our technology, and then we'll get into the formal part of the presentation. Peter?
Okay, thank you, Walter. Let me pull up the video. Can you see this, Walter?
Yeah,
Yes.
we can see it.
I think your audio,
yeah.
Peter, isn't playing.
Okay, how do I share the audio on here?
Is your volume up?
Yes. Let me. Oh, here we go. All right, I apologize. Let me try this again.
Welcome to MyMedicalHUB, where we're introducing a completely new era in musculoskeletal health. We know that hundreds of thousands of MSK injuries happen every year. These are the top medical issues plaguing Americans and result in about 1/3 of all lost workdays. These issues are costly. Most employer claims stem from just 25% of employees, and that's because the average cost of care is $42,000. This is in addition to the missed workdays and losses in productivity. But much of this pain and cost can be avoided. Our new physical score is an AI-based objective measure to understand MSK issues, and it can be performed anywhere with internet access. It has been shown to be 96.4% accurate. Like a cholesterol test, if the score is high, there may be a problem. The user simply answers a few questions and identifies any pain points. Then, using a laptop or smart device, they will be led through a series of measurements, which takes about 15 minutes. They don't even need any sort of special equipment. The screening can be led by a provider or by our AI. Our SAAS solution is based on a machine learning foundation with a powerful neural network. In fact, it has already digested thousands of research studies to identify the most efficacious care plans. Overall, our ecosystem is constantly collecting data and refining its results. A person needs that data when they're at rising risk to know how to avoid damage to joints which leads to catastrophic injuries or move to the best interventions. So we've created a suite of AI-driven tools to do just that. Our health plan modules address injuries or risk and work in tandem with our virtual coach. Our telehealth portal for assessments and consultations supports early detection efforts. Possible injury diagnoses are always offered to providers for their validation, and any needed interventions can be self- or provider-led. Care steerage and patient navigation is structured to comply with the employer's standards and expectation. User monitoring is available through the health tracker with headless data provided to the corporate portal. Results are also tracked to support optimization efforts. This is the first standardized platform to deliver objective, data-driven MSK assessments that can be administered virtually. While our solution is grounded in advanced technology, it's accessible through the tools we use every day. In fact, we're all carrying the solution in our pockets. Welcome to a new era of musculoskeletal health from MyMedicalHUB.
Nice.
Thanks. Yeah, and I'd like to take a couple of minutes and go through some slides. Oh, go ahead. Oh, yeah, it's abbreviated. We usually go through many more, but I want to hit the high points. But really, having worked in the provider side of the industry for over 35 years, when I first saw MyMedicalHUB, I truly believed it was transformational. And we all believe it's transformational. And it will, using artificial intelligence and machine learning, we believe will bring a whole nother perspective to providers and their healthcare that they provide. How do we do it? We have advanced technology that intelligently transforms how data is now collected and will be collected in terms of movement, and created a standardized platform that can be applied to a number of situations and across a number of venues to collect this data. And as Walter mentioned, machine learn it based on outcome studies and evidence-based medicine that is generally accepted within healthcare. And we gather about 1,000 points of data per assessment. And from a time perspective and even a cognitive perspective, there's absolutely no way providers can replicate what we've been able to do through our computer vision. The problem is significant. As Walter mentioned, over $1 trillion spent on musculoskeletal related care in the United States. And that doesn't count, as he mentioned, the medications associated with it. What it also doesn't count are missed work days. So employers will be first to note that in addition to the medical expenses associated with workplace injuries, the lost production is also very significant. So about 600,000 labor-related injuries a year, and on average, the ones that require medical intervention significant cost about $42,000 per case, and it represents about a little over a third of all work days. We want to solve that issue in part by getting ahead of it, recognizing issues when they're asymptomatic, and providing low-cost interventions and care navigation to help employers lower their costs and enhance work days. How do we do it? You'll see it, and we're excited to show you the demo. but we have an AI-powered platform that actually collects data, superimposes sensors on the human body, can track movement. It's accessible anywhere, and as Walter mentioned, on any type of smart device that has internet connectivity, we can collect that data. And what is generated is an objective score we call our physical score. And it allows us to be able to begin to compare like situations and like individuals across large populations of patients, and actually act as a predictive tool in a very, very accurate way. We think this is going to be transformative. And when you think about how medicine has evolved over the years, and think about measurements like cholesterol levels and blood pressure, we believe our physical score will become a standard in the medical industry for tracking objective musculoskeletal related measurements, and that it's able to gather this information and create a unique objective score in a very cost-effective, convenient way. And it is an amazing platform. At its core is our AI and machine learning, but we've built around that an entire platform that can be used to navigate care, integrate into physician work plans, create meaningful, actionable information, and do it 24 hours a day, 7 days a week, 365 days a year. It's all cloud-based and can produce almost instantaneous results. And the more cases we get in our system, the more it learns and the more accurate it becomes. Our physical score is really what is a component that's unique to our platform. So within a matter of 15 minutes, someone can conduct a virtual assessment, and it's able to generate a tremendous number of correlations that brings in a wide array of evidence-based research, clinical protocols, evidence-based medicine, and generate a report, information, interventions, and a tracking mechanism that all lead to improved musculoskeletal health or optimal care navigation if a provider's intervention is required. So everybody knows their blood pressure, they know their cholesterol score, and we believe in a short period of time, everybody is going to know their physical score, and that the market for this type of technology is worldwide. And it can be delivered very easily and conveniently and efficiently.
All right, I think it makes sense to get into the demo now. So I'm going to go ahead and, Walt, I'll request you to just share your screen real quickly. Walt is actually already in the telemedicine room. Prior to this call, I had actually sent Walt the request to begin his assessment. So once Walt shares his screen, you can take a look at what Walt sees. All right. All right, so this is the telemedicine portal that we're in. I'm going to be the fake doctor today for Walt. But essentially what you're looking at here, Walt has already filled out phase 1 of our assessment. Okay, so he answered a number of questions. First off, starting with activities of daily living. Okay, so this is the stuff that Walt does every day that he doesn't necessarily think about that can lead to overuse injuries. The system then goes into asking him questions about his medical history, his family medical history. So we want to find out if Walt has suffered a musculoskeletal injury in the past, or if he's predisposed to a certain musculoskeletal condition. And then what our AI does is ask some questions about any kind of chronic chief complaints. So this isn't necessarily stuff that maybe is bothering Walt today, but maybe it's things that flare up every couple of days, every couple of weeks, every couple of months. So we do a deep dive into those chief complaints. We find out, what kind of pain is Walt experiencing? Is it dull pain? Is it burning pain? Is it sharp pain? What's the frequency of that pain? Is there any tingling or numbness associated with that? What kind of treatment has he tried, if any, to try to alleviate the issue? And then we ask him on a scale of 1 to 10, obviously, what his pain is. So Walt's already filled all of that out. He is now in the telemedicine room. We're going to go ahead and we're going to begin this assessment. Now I'm going to go ahead and share my screen. Walt, if you come back and stop sharing so I can share mine. I'm going to give you a view of what the provider sees. My view is a little bit different. It's more of kind of like a heads up display. Walt's going to continue to see this telemedicine room with the dual screen. So he's going to still see me. This is what I see now. And so we're going to go ahead and we're going to begin a cervical assessment on Walt. And I want to make sure everyone can see my screen now.
Yep, we can see the whole dashboard. Yep.
All right, awesome. So Walt, the first thing we're going to do is we're going to take a front postural view of you. So our system is going to look for any asymmetries in your shoulders, your hips, your knees, your ankles. All right, so just go ahead and stand there looking straight ahead. Perfect. All right, so Walt, do me a favor. If you could turn with your left side facing the camera, the next thing we're going to do is we want to take a look at your side posture. So our AI is going to determine whether or not Walt is exhibiting a forward head carriage or rounded shoulders. All right. And Walt, I'm just going to need you to go ahead and stand there looking straight ahead, just like that. Perfect. Okay. All right, Walt, continue to stand with your left side facing the camera. The next thing that we're going to do is we're going to go ahead and I'm going to have you look straight up in the air for me. All right. All right, Walt, can you look straight up in the air for me? All right, perfect. All right. And now, Walt, when you did that, did you experience any pain?
Yes.
You did, okay. All right, Walt. Next thing that we're going to do is when I say go, I want you to look straight down as far as you can. I want you to try to touch your chin to your chest for me, all right? Go ahead, Walt, look straight down for me. And you can stop. Perfect. So Walt, when you did that, did you experience any pain?
No.
Okay. Did you feel an electric sensation traveling down your spine, arms, or legs?
No.
Okay. All right, Walt, can you do me a favor and face the camera now? So what we're going to do is when I say go, I want you to turn your head to the left as far as you can. Try not to roll those shoulders back, all right? So keep the shoulders stationary. Go ahead, Walt, turn your head to the left as far as you can. And you can stop. All right, Walt, what about now? Did you experience any pain doing that movement?
No.
Okay. All right, Walt, what we're going to do now is just the opposite side. So instead of turning your head to the left, when I say go, I want you to turn your head to the right for me, okay? And everyone, before I have Walt go ahead and do this, I did want to bring attention to this animated GIF on the right side of my screen here. So Walt sees that also. We have that there just in case the provider doesn't do the best job of explaining what he wants Walt to do. Obviously, looking to the right isn't that much, it's not a tough thing to describe to somebody, but some of these compound movements as you're getting into a full body assessment can be a little bit tough to describe. In any event, Walt, go ahead and turn your head to the right for me if you can. All right, perfect. And you can stop. What about now, Walt? Did you experience any pain?
No.
Okay. All right, Walt, next thing I'm going to have you do is instead of turning your head to the left, what I want you to do is I want you to tilt your head to the left as far as you can. Don't scrunch your shoulders. Try to bring that ear to the shoulder blade, okay? Go ahead, Walt, tilt your head to the left for me. And you can stop. All right, Walt, when you did that, did you hear any popping or grinding sounds in your neck?
Yes.
What about tingling? Did that cause tingling?
No.
Did that cause pain?
Yes.
Okay. All right, Walt, the next thing that we're going to do is just the opposite side. So instead of tilting your head to the left, you're going to now go ahead and you're going to tilt your head to the right as far as you can, okay? Go ahead, Walt, tilt your head to the right for me. And you can stop. All right, Walt, what about now? Popping or grinding sounds, did you hear any of those?
Yes.
What about tingling? Did you feel tingling?
No.
What about pain?
No.
Okay. All right, Walt, what I'm going to have you do now is with your arms out at your sides, I want you to raise those arms out and up over your head as far as they'll go, all right? But keep those elbows locked for me, okay? Go ahead, Walt, raise your arms out to the sides, up over your head. Perfect, perfect, perfect. And you can now stop. So Walt, when you did that, did you experience any pain?
No.
Okay. All right, Walt, the last thing that we're going to do for your cervical assessment is Almost kind of like flexing your muscles. I want you to raise your arms parallel to the floor. Then I want you to flex at the elbow and try to touch the tops of your shoulders for me, okay? All right, Walt, go ahead. Raise your arms out to the side. Flex at the elbow. Fantastic. And you can stop. So Walt, when you did that, did you experience any pain anywhere in your body? Your neck, your shoulders, your elbows, wrists, or hands?
No.
Okay, perfect. All right, everybody. So this was a cervical assessment. As you can see, it didn't really take all that much time to do. You know, each body region would only take maybe 10 to 15 minutes. A full body assessment is probably going to take you maybe 35, 40 minutes max. So what I'm going to do is, before I go ahead and create Walt's report, I'm going to show you what our AI was doing in real time. And again, keep in mind, and I know that, you know, Peter mentioned this a little bit earlier, but we don't need any wearables. Walt's not wearing anything. He doesn't have any sensors on. This is all being done through his computer camera. I'm on a Microsoft Surface tablet. Okay, so this is all SAAS. It's all software. So this is Walt's front postural view. So the AI is determining whether or not Walt has any kind of asymmetries in his stance. We're now looking at Walt's side postural view. So the system's trying to determine if Walt's going to exhibit a forward head carriage or rounded shoulders. That will present itself in the report once we get to that. And I could keep going, but I'll just show you cervical extension real quick. So this is Walt looking up as far as he can. All right. And so I'm going to go ahead and I'm going to close, and we're going to create Walt's report. So you guys just saw a provider-led assessment. I know Walt mentioned this earlier, but we actually have Emma, okay, our efficient musculoskeletal management assistant, and she can walk someone through this just as well as I could. So if Walt wanted to, he could do a complete assessment on his own with no provider intervention. So we're just going to go ahead and save and close. Walt, see you later, pal. You can leave the telemedicine room.
All right, thank you.
All right. What I'm going to do now, guys, is I'm going to go ahead and I'm going to pull Walt's report. And we'll go ahead and show you this. So one thing I do want to mention, so this is going to be a provider report. This is provider-led assessment, provider report. This report would be very different if Walt did this with no human intervention, mainly because we give possible diagnoses in the provider report. At the end of the day, we don't want to be WebMD. I don't want Walt doing assessment. And, you know, for one of these, you know, orthopedic special tests to run through, one of which was Lermit's test, where I had Walt look down. I asked him if there was any kind of electric sensation traveling down his spine, arms, or legs. That's Lermit's test. If he would have said yes to that, he would have been positive. That's a possible indicator for MS. So I don't want Walt doing this, and then all of a sudden his report's telling him he has MS, and now he's freaking out. Okay, so this report's going to be very, very different and far more data rich and more involved than say a patient report would be. So what we're looking at is Walt's cervical assessment report. And so the system starts off with this introductory narrative where it's laying out Walt's physical score, right? So this is that quantifiable metric that we were talking about, where we can now benchmark and baseline a patient's level of musculoskeletal health and then track their progress throughout care. So Walt's coming in at a 254. That's in the middle moderate range of risk. Believe it or not, this is an improvement for Walt. About 2.5 months ago, Walt was actually at a 292. So he was at this high threshold on our scoring scale. The scale runs on a 100 to 399 scale. Anything over a 300, and you have all the components of a full-blown ICD-10 diagnosis or musculoskeletal injury. So we'll continue down here. And the report just lays out a brief synopsis of all of the subjective data that Walt filled out. So his activities of daily living, his chief complaint that he put into the system, where he's saying his neck on the left side is a level 4 in pain. Any kind of prior injuries or accidents Walt has had, excuse me, his range of motion. It gives him a brief just rundown of that, where he's within functional limits with exception to cervical extension, cervical lateral bending. If there were any sensation deficits for Walt, this would be listed here. And then the system goes in to give a postural screening on Walt. So we always do posture screening on everybody, whether they're doing just a regional assessment or a full body assessment. So posture is always going to be taken. And so here the system did identify Walt is exhibiting a forward head carriage. Rounded shoulders, he does not have those. He does not have scoliosis or kyphosis. As we continue, this is the range of motion readings for Walt's neck. So for the cervical assessment we just did on him. So what the system does is we lay out what normal ranges for individuals would be here. And then we have what Walt's readings are. Anything red means Walt is hypomobile. So he's under what a normal range of motion would be for this individual. And that pings as a risk factor in our system. So then all of the different screen captures on those movements are listed here. And then this is that special test I kind of referenced a little bit earlier. So Lermit's test. So he was negative on Lermit's test. The system then goes on to lay out all of the individual risk factors that ping for Walt. So anything in his personal and family health history, his activities of daily living, and then the biometrics we just took. This is a complete readout of all of the risk factors our system identified. And then here are the possible care classifications or diagnoses for Walt. So Peter did mention this also prior, but one of the great things that we allow providers to do with our system is override the AI. So if I'm a provider and I don't think that Walt is suffering from cervicalgia, I can delete it from the report. Conversely, if I think the system missed something, I can add it to the report. And as more lives go through the system and more of these changes get made by providers and confirmed by providers, our AI learns it. Our AI is ever evolving, ever learning. And as these changes get made, it gets more and more efficient at identifying these. The system then lays out corresponding ICD-10 codes, and then it develops a plan of care for Walt. So maybe a TENS unit would be good for Walt, moist heating pad, and then the system's going to identify that Walt should be doing an at-home exercise protocol. And he actually has been doing it, which is why his score is now a 252 instead of a 292. We give short-term and long-term goals, ergonomic considerations, and then here is Walt's at-home exercise plan. So these are the exercises our system and our AI thinks Walt should do to try to help that score get even lower. And one of the things that we also have a module for, and Walt's going to actually show you that in a little bit, but we give providers the ability to check in on their patients to find out if the patient is compliant or not. So we actually have an app where our AI will watch patients doing these at-home exercise therapies and identifying whether or not they're actually completing them or not. And then we get into all the evidence-based research to back up why the system found what it found. So as you can see, I mean, this is a pretty data-rich and detailed report that our AI just developed in like a minute and a half at the end of the assessment. So Walt, if you want to go ahead and share your screen so everyone can see the at-home exercise module that we have.
Yeah, and before I do, a couple of things I want to make a note here of, make mention of. About a week and a half ago, we announced a partnership with Microsoft, where Microsoft has invited us into their health cloud. Microsoft is looking to have this as one of their assets in their cloud, and to fill the need of identifying musculoskeletal risks within these global populations. Microsoft has extensive reach. They have over 140,000 healthcare related systems, provider networks that they work with around the world. And we're in the process of moving our technology assets within their health cloud. I'd say right now we're about 45 to 60 days away from completing much of this. I know you all saw the telemedicine encounter. I think most of you are probably aware, similar to Zoom, Microsoft has something called Microsoft Teams. The telemedicine encounter that you just saw, we will be providing the ability to conduct these musculoskeletal assessments through the Microsoft Teams environment. Not that long ago, a company called Teladocs, who is the largest here in the United States, the largest telemedicine company, they've announced also that they're moving into that Microsoft Health Cloud. So as these assets and these services are incorporated into Microsoft's Health Cloud, other Microsoft partners, including companies like Teladocs, will have access to these services. So today, for example, those of you who have used Teladocs or other telemedicine type services, you know, many times it's being used for looking at things like, for example, does somebody have the cold or potential flu? Obviously, without the ability of collecting objective information from a musculoskeletal standpoint, companies like Teladocs or other companies who are in telemedicine companies who reside within Microsoft's Cloud for Health will have access to the service that you just saw today. So we're quite excited, to become a partner of Microsoft's. We're also doing things to help address the fall risk issue. Here in the United States, we spend a lot of money, billions of dollars a year, on people who encounter fall risks. So helping to evaluate who is at risk of falls is something that we're in the process of working on with Microsoft. And we feel we'll be able to help tens of millions of people, if not hundreds of millions of people around the world. So with that being said, I'll go ahead and I'm going to share my iPhone in just a moment. Now, in this case, Drew had just assessed me. When a physician goes ahead and signs off on her or his notes, in the patient application will reside these interventions. So, so at MyMedicalHUB, we're in the process of machine learning over 400 physiotherapies. So as our system identifies these care classifications and looks at a deficiency that one may have and what's needed to do to mitigate those risk factors to prevent that degenerative musculoskeletal issue from taking place, we've developed an application that allows us to visually look at a person as they're performing these self-care management or these exercises at home, and can report the results back to the provider. So the provider can look at, for example, did somebody perform that self-care management, right? Were they able to successfully do it? Was the person experiencing pain, right? What else can be done if the person is not getting through that self-care management to make more timely decisions within those plans of care in order to hopefully get someone through where they can remediate these issues conservatively. If for whatever reason, somebody is failing this and failing conservative plans of care, perhaps they're better suited to take a more evasive approach, like a surgical intervention, where somebody could be now referred to an orthopedic surgeon, for example, or an interventional pain management physician, right? So having the ability, an assistant like this, that can track a person as they're going through a care continuum is very important, right? Is a person likely to respond to that conservative plan of care? Are they successful while they're going through the conservative care? Where did they achieve maximum improvement? And did they ultimately move to a lower risk stratification where they're no longer at imminent risk? These are all things we now can discern through this musculoskeletal ecosystem. So I've never done this before via Teams while I'm sharing my iPhone screen. And I also have you all on my laptop computer. So I'm going to go ahead, I'm going to mute myself on my laptop for just a moment and turn on the Zoom on my iPhone.
Okay, I trust.
Yeah, you may just have to turn off your speaker on your
Yeah, I'm sorry. Can everyone hear me okay?
Yeah, we hear you.
Okay, great. Okay, I'll go ahead and share my screen now.
Got it, Walter.
Okay, excellent. Thank you. So here you can see an artificial intelligent iPhone application where an assessment was conducted. In this case, this was actually an assessment that was performed yesterday. We actually demonstrated this to an extremity orthopedic surgeon in New Orleans who's agreed to implement this into his practice management. But I'd like to show you all today what I mean by the actual physiotherapy. So in this case, Drew went ahead and approved those physiotherapies. An end user would go in and they're able to now see what exercises have been assigned. These exercises could be put on a calendar. So let's just say Monday, Wednesday, and Friday, based upon my my clinician's plan of care, which would be perhaps 3 times a week. These exercises could be put on a calendar. And once they're on a calendar, Emma, our assistant, will actually remind me to perform these physiotherapies. This is something that I can conduct anywhere. If I travel in a hotel room, in my office, or at home, this is something that I could use anywhere, providing I have internet connectivity and my application. So I'm going to go ahead and just press start workout. So here, hopefully everyone can see our artificial intelligence and how it's seeing me, right? Where it's seeing my joints in my body and it's picking key points, markers, virtual markers on my body. Can everyone see that?
Yes.
Okay. On the upper left-hand corner, you can see the reps and the sets. In this case, for pronon elbows, it's showing me that I'm going to be holding for 60 seconds. And also, if I'm doing these things wrong, a count will come up here. So what you see here is part of this application. MyMedicalHUB has created an AI or machine learning physiotherapy app that our doctors of physical therapy actually go in and are able to define the parameters and understand what type of movements, what needs to be understood with those exercises. So they can go ahead and take a look at every joint, every limb, where it's supposed to be as I'm moving through an exercise, right? We also have the ability to understand other more advanced biomechanical movements, right? So through our AI biomechanical data sets, we can machine learn just about any movement. So whether it's a physiotherapy, golf swing, baseball swing, you know, any of those things, we've developed this other machine learned application where we can now go in and take a video, learn that video. So for example, if we wanted to learn what makes Tiger Woods swing so special, we can go in there and machine learn that and then have other people do a golf swing and show them where they're getting it right or wrong. And if you notice on the screen right now, for this exercise, you could see the red and the yellow. When I'm in the proper position, those colors will actually turn to white, okay? So as you can imagine, just going through a golf swing or some type of biomechanical movement, this is the type of discernment that we have taught in our advanced AI biomechanical models, okay? And I'm gonna go ahead and demonstrate to you just the pronon elbows and the benefit of what an end user or a patient would have, right? Because many times, right, people who have these plans of care for self-care management, while they may be given instructions on a piece of paper on what to do or emailed to them, but do they really know whether or not they're actually doing these things right or wrong? And you'll get to see this in live here on myself as I show you. So I'm going to get into my pronon elbows position here. So you may not be able to hear, but Emma is actually counting down. And you can see now all of my joints and limbs in different areas in the right position. If I go out of the parameters, she'll actually stop counting for me. Now I know I'm doing it wrong, and there's instructions on the screen. Can you all see that?
Yes.
Yes, yes.
When I go back in the proper position, and my head, shoulders, elbows, hips, back are where they're supposed to be, Emma starts to count down and let me know. But my guess is you probably can't hear her audio, but I can hear it.
We can see the numbers counting down on the screen.
Okay, but you can't hear the countdown, correct?
Correct.
That's the limitation of Zoom, but she's actually counting. And then once, of course, I'm in prone on elbows after my 60 seconds, she'll tell me to take a rest and then when to resume. And again, this was a protocol that was defined by my provider. Some providers may want 3 minutes. Some providers may even want up to 5 minutes. Depending upon the severity of that injury, all of these things are possible through this musculoskeletal system.
Okay, so now I'm done. The system is asking me, do you feel any pain? If I were to say yes here, the system would actually open up a journal, a pain journal log for me, a bot, where I can go in and actually select where I felt pain, the type of pain I was experiencing, and this information would automatically go to my provider. Based upon my responses, the provider can have an automatic encounter generated with their office. So for example, if I did experience pain when I did that, and the provider automatically had a predetermined set of protocols where if my patients experience these things when they're doing self-care management, create an appointment with my office or even this particular resource within my office as a, for example. But I know we have a brief period, a limited period of time. I know it's 3 o'clock. I'm just going to say no here, but I think everyone gets the idea of the use of this technology and the benefit. So Arthur, I think at this point in time, due to the time, it probably makes sense to open up some of the questions.
Yeah, so we got a few. As it relates to what you just did, is the exercise benchmark a function of the exercise, or is the benchmark created by the physician? So it might be idiosyncratic to a patient. Meaning are the exercises standard, or are they modified based on the potential injury?
Excellent question. It could be both. So the system will generate what it feels to that provider. And by the way, the system will look at other outcome measures of other like patient profiles, right? So as Peter mentioned earlier, we collect over 1,000 points of musculoskeletal insights in a person. So our data science servers see a very unique profile. So Arthur, for example, right? I'm 51 years of age, right? I'm 245 pounds. I'm 6'2". I have a particular, family health history, personal health history, the activities that I like to do, right? So if there is a like profile to myself, and if we have a certain relevance that's already generated within the system, where that provider now can see out of the 20,000 other similar profiles that meet my profile, here are the applied interventions, and here are the goals based upon those other like 20,000 lives. These are the goals that could be achieved, and we can present that relevance to that provider. Now, if a provider wants to go ahead and change those exercises, change the phases of those exercises. So today, we break out each physiotherapy or each exercise into 3 phases, right? So depending upon that severity, somebody may start phase 1, phase 2, or phase 3. A provider has the ability to not only change those exercises entirely, they can also change the defined phases of those exercises as well. Okay.
Duration, that sort of thing. Yeah.
Everything. Correct. Yeah. Yes. Yeah.
Yeah. And just to give some many of the folks may already know this, but I think it'd be helpful to know that in the absence of MyMedicalHUB, as you've designed it to be implemented, what is the standard of care presently?
Well, look, this it's interesting. So what's the standard of care? You know, there are it all depends. So there are other digital MSK companies that are out there that are really looking to disintermediate the relationship, the normal referral type of relationships that happen. So for example, you know, one of the digital MSK companies that are out there, they do virtual exercises where they're typically, these people are typically managed by health coaches, not even physical therapists, and they ship them out wearables. So as you saw, the biomechanical movements that we capture through a standard device, they're doing with those wearables. But what we're really looking to do, Arthur, is we're looking to empower providers. We never give a diagnosis through the system to a patient. The only way a diagnosis is rendered is via a licensed provider, to make that clear here. And we're looking to provide that provider with insights to provide them more precision care management and also help them achieve better outcomes, but also bring to their attention that there is an intervention that based upon the system's findings, those 1,000 points, there is an intervention out there that has a high degree of success, and we want to show that through relevance, right? So the difference between MyMedicalHUB and these other digital MSK companies out there, we want to empower providers with these insights, but also empower the patient so that they can have a better understanding of what risk factors they're afflicted with and understand that plan of care and what those intended goals are, right? So that helps with patient compliance, it helps with adherence, and should ultimately translate into better outcomes.
And not to mention that this is pushing up against well care instead of sickness care, right? So identify things in advance before they become problems.
Exactly. I'd like to kind of add upon what Walt said. I mean, we want to try to stop people from getting injured, right? We want to intervene before a catastrophic injury occurs. You know, a lot of what's going on out there is, you know, the current standard of care. Okay, wait till someone gets hurt, right? We want to step in. We want to stop that from happening.
Yeah, makes sense. Also,
Sure.
I think that, and just a comment. So it's just me thinking along here, not knowing what I'm talking about. But if you disintermediated the doctors, then you're killing your biggest distribution portal.
I think so.
Yeah.
But the other thing, Arthur, is look, you know, we understand that, you know, the physicians are the ultimate experts, right? And while we're getting these collective perspectives incorporated into our data science servers, we believe the ultimate rendering of a diagnosis belongs in the hands of a licensed clinician. And the other thing, Arthur, I want you to know is, in order to better help these providers, we also have the ability to read the diagnostics, those MRIs, X-rays, diagnostic ultrasounds, EMG, NCV studies, right? And the reason why, Arthur, that's important is we build correlations between the standard evaluation, and we could look at, did the system get this right? Did it get it wrong, right? So we can kind of confirm the findings of the system through the readings of those studies. And this is something, through our relationship with Microsoft, is going to be a phenomenal accelerant for us, right?
Right.
In learning and building these deeper correlations, if you will, right?
Yeah.
Yeah, and the reality is there's tremendous variation just amongst providers in the way they provide care. And now with MyMedicalHUB, there is a way to quantify and measure that and track those variations. And when you think about healthcare, where you first enter the healthcare system will play a tremendous role in determining how much it'll cost you and what types of services you'll consume. And there's been no way to really measure that and track that in an objective way until now.
Yeah, you
So
sort of
we-
can predict what the expenditures are going to be. I see.
Correct,
that.
and use it for value-based care and rewarding physicians who create good outcomes and tremendous value. There's so many applications to this platform. We've touched on a few, but we need about 4 hours to hit all of them.
Right. So the super cool. I hadn't seen, Andrew, the backside of the tech, so that was helpful to me as well. I saw the front side.
Yeah.
We are going to run out of time, so can we get into the ask?
Yeah, sure. And just two things with respect. So this is a subscription model, right? So how we make money is providers and end users pay us a subscription, right? So, and there's also a per assessment fee. So providers who want to get involved in population health management, there's a monthly subscription, and then there's a per assessment fee that is charged to those providers, and then to those end users with the application that you see, there's a monthly subscription charge for that. So this is a recurring subscription-based service, and let's just say a per click-through. The Ask Author, we presently have a $5 million private placement that's out there, and of that, there is approximately $700,000 left of it. So that's what's left.
And prior to that, how much has been raised?
So we're looking at about $4.3 million has presently been raised.
No, I'm sorry. Was this the first round?
Yeah. This is our Series A. Yeah, and prior to this author, I had personally funded the company.
And so the tech build out is all your proprietary build out, with the exception of the Microsoft collaboration going forward?
Correct. All of the technology assets that you've seen today to pull this all together has been MyMedicalHUB's. We presently have 2 patents that have already filed. Our patent law firm is Greenberg Traurig, and we have about a half a dozen additional patent filings that we'll be submitting. So we should have a pretty significant IP portfolio.
Yeah. And the raise is an equity raise, or is it a combination of convertible debt and equity?
Yeah, it's called a participating preferred.
Yeah.
Is Bob Taggart on with us?
Yeah, I'm on.
Yeah. Hey,
So-
Bob, would you like to address the raise?
Yeah, it's a participating preferred with a 6% coupon at a $25 million valuation. So, with a participating preferred, whenever we exit, the investors will get their money back and then convert that to $1 a share. And by the way, Walter, we also have the opportunity to go to 6 million if we decide to. We are talking to other companies in terms of a B round, and I don't know if I can opine on that, but there are 3 different companies that want to work with us at a much higher valuation, hopefully, as we move forward. But that's our plan, is the participating preferred with the coupon.
Yeah,
And
and Arthur, this will be the most senior paper. So it's a preferred position, preferred participating preferred.
Yeah.
Okay.
got it. And the work that you've done so far in terms of clients, or is it pilot work or is it funded work? In other words, are your customers been just pilots, or do you have revenue?
No,
Or-
we do have some revenues, and we have providers that have been using us. So the original joint venture arrangement the company put in place was actually a Blue Cross Blue Shield provider network in the state of South Carolina. And you know, what you've seen with the practice management side of this, like through the telemedicine, we worked in collaboration with them. Barry Fitch, who was originally the president of that group, not this past January, but in January of 2021, actually joined our organization. And he oversees now our clinical operations. But much of these learned AI models, Arthur, as you can imagine, when you take a look at the accuracy, right, of how we're able to discern, you know, it has taken us, you know, a considerable amount of time to teach our system these types of discernments. We now have it. So we're now actively going out, and I'll tell you, there's about 20 Fortune 100 companies that we're now engaged with over the last, let's just say 90 to 120 days. And it's everyone from, you know, the automobile industry, airline industry, a very large health benefits consulting company that you all would recognize, and even regional health benefits consulting companies, you know, all of which we can empower, right? The neat thing about MyMedicalHUB is with the data lake that we have, we can empower, let's just say, an Aon, right? A Marsh McLennan Mercer. We can empower a corporation to identify where their risks are. What can they do to feasibly mitigate and prevent these catastrophic claims from happening, right? Where should these potential injured employees be care navigated to? What are the expected outcomes that should be achieved, right? And of course, there's the B2C model also, right? So now that we have an iPhone app and a Google Play app, right? And we don't have these published in the repository, but as you can imagine, Arthur, globally, and with Microsoft's language sets, we can deploy those applications globally. And then we can care navigate those people to the appropriate musculoskeletal clinicians based upon those clinicians that are available within those footprints around the world, right? And we can help even national health systems identify what resources they need to address the risk factors that have been identified through this ecosystem, right? So we can really help transform musculoskeletal care really globally, not just here in the United States, right? Really anywhere in the world.
Yeah, it's reminiscent of, on the one hand, you're keeping the cost down so you don't have catastrophic claims. On the other hand, it's a business development tool for the practitioner.
Absolutely. And creating better continuity, but also enable them to even build their practices, right?
Yeah.
So, you know, this is something that could be deployed in county governments, city governments, school systems, right? You know, it's interesting. When I was growing up in the 70s, my family practitioner performed musculoskeletal evaluations, looked for things like leg discrepancies, scoliosis. These pediatric physicians, the way that these health plans or these payers actually pay these clinicians, they don't have the time to do proper musculoskeletal evaluations. So we can empower these different clinicians to have a musculoskeletal assessment. They can get those reports and then hone in on the problem populations that they serve, right? So now there's a feasible way, Arthur, to address this. So this is something that can help them identify risks within those populations that they serve.
This is not a fair question, but my mind, and I think others might immediately go to this. So if there's a licensing, and I'm going to get the words wrong, for the physician, and then a subscription for the physician, and then a per scan, is it 6 months and 200 scans that get you to with a return on investment, or is it something less than that?
For MyMedicalHUB, we, our margins are 90% or better. So immediately, we start making money. For the clinicians, and how they track progress depends on the protocols that they see fit, right? So, however, the health plans, Arthur, or corporations, so more and more corporations, right, they're building their network of excellence. So when you see, for example, Walmart, even Coca-Cola, they are forging their own relationships with providers across the country. In fact, they call them destination care centers, right? So, so a big one, let's just say up out of New York, we use Hospital for Special Surgery. By the way, we're talking to them, and their head of sports medicine, Dr. DeFori. So they're building their network of excellence, and what they're going to want to see is they're going to want some type of transparency, right? Because think about what happens today. When one of their employees winds up getting injured, they don't know where to go, right? So they may go to their primary care physician. They may go to a chiropractor, right? But the truth is there are lots of different musculoskeletal specialists. So when you have an injury, would you really know where to go? Are you better off going to your primary care physician, a physiatrist, a PM&R doctor, an interventional pain management, a neurologist, an orthopedic surgeon, a neurosurgeon, a chiropractor, right? It's a very, very fragmented field. But if you were able to collect these risk factors and be able to evaluate the neuromusculoskeletal dysfunctions, you can more accurately refer someone to the right clinician, right? So even as a primary care physician, to create the best possible referral, not just based upon someone's golfing relationship with an orthopedic surgeon, for example, now you can get someone to the right specialist the first time. And the other thing is this, think about what happens today. And I'm not saying this happens all the time, but let's just say you happen to wind up at a chiropractor's office, right? Well, one of the things that infuriates a corporation and a health plan is someone goes to a chiropractor, they're not a conservative care candidate, and the chiropractor, let's just say, architects a plan of care that involves 20 treatments, and the patient doesn't get any better. In fact, they get worse, right? So think about those wasted encounters. Think about the cost that was just incurred, right? And you now have an unproductive employee, right? So we can
And
really—
you have to start all over again.
And you got to start all over again, right? So this is something that can create enormous efficiency, and you could provide the outcomes in a transparent way. And we actually have a corporate dashboard for employers where they have visibility to this type of information, right? So as they go out and they build those network of excellence, they can see where they're getting by condition the best outcomes by provider, right?
Because you captured the data, right?
We captured the data, and Arthur, they can actually pay those providers a bigger fee schedule, right? Based upon an improved outcome, right? Called value-based care.
Yeah, yeah.
So Arthur, and so we see the system within musculoskeletal health anyway, the only system that's out there that has the ability to really implement a true value-based care arrangement, a system, an ecosystem, right? With a true outcome measure by those objective findings. Okay.
Totally makes sense.
No, thank you. Any other questions?
There's a couple, but I'm going to send them to you because we got to scoot.
Okay.
But this has been super, super helpful. Very appreciative of you guys doing this, especially in such detail, and then actually demonstrating it. It's kind of like going to the pet store and holding a puppy, right?
Well, we thank you, Arthur, and we thank everyone else for their time today.
Yeah, and really appreciate you guys being here. Like I said, we're going to make sure that if it's okay with you to post the recording, we'll send you the link so you can socialize it as well. We'll put you in touch with everybody that was RSVPing for the webinar here today, and we could probably stay and talk I certainly could stay for longer, but we'll be kind to our attendees here and let them go. So thank you guys very, very much. Nice to meet you, Peter. Andrew, nice to see you again. Walter, nice to meet you. And then you'll have some follow-up from us. And like I say, thank you everybody in the community for joining and sharing with us the only thing you can't make more of, and that's your time. Until next time. Thanks, guys.
Thank you.
Thanks,
Thank
Arthur.
you.